So, as a patient, how do I know, or even if I'm not a patient, if I am to check it at home, how do I know my pelvic floor is weak? Is there any way of knowing it?
Yeah, I mean, so your pelvic floor is part of your core. It works with your abs, your transverse abdominals, and then your multifidi, your low back muscles. And so a lot of times you may have, for especially for women, you may have some back pain. You may notice that you feel pressure or heaviness down in your pelvis. And especially at the end of the day, because gravity works on our muscles, right? So toward the end of the day, you'll feel that. One of the things that a lot of people see on the internet, they'll say, train your pelvic floor muscles by stopping urine and do that,
Mhm.
so many times on the toilet. That's the worst thing you can do. But I tell patients, you can do it one time to see if you can stop the urine flow, but don't do that as an exercise because then you're retaining urine. And so that's one of the things. But the other thing I was going to say, a common myth is that Kegels are for everybody. And
Right.
if you go on the internet, it's like you can see all these different ways and different programs on doing a gazillion Kegels a day. And not everybody needs to do Kegels. If you come to me with pelvic pain, that's usually because you have overactive pelvic floor muscles. And I'm going to tell you, do not do Kegels. For my men who have prostatitis, and I tell them do not do Kegels, or if they have rectal anal spasms, I tell them don't do. It's not about training the muscles to up, to contract up. It's about down training them. So I have to teach them the opposite thing with breathing and with how to use their muscles to drop their pelvic floor muscles. So to down train them. So that's why Kegels, that's the other big myth is that Kegels are for everybody. They're not.
Exactly. I mean, that was my next question because whenever we talk about pelvic health, Kegels is something that's mentioned almost parallelly.
Right.
I was about to ask, is that accurate? And as you just mentioned it, I probably was doing it wrong, or I might not have needed it, but I was doing it nevertheless.
Right. And so what we want to do is work with our breathing because your diaphragm and then your pelvic diaphragm, your pelvic floor, it acts as a piston. So you want to contract your pelvic floor, but also exhale. So we breathe in and we relax our pelvic floor muscles. And then when we blow out, we contract our pelvic floor muscles. So it's like a contraction, but it's with breathing. So I could have somebody on the bed if they're just doing Kegels and they're not breathing, because I have some people, they hold their breath and they're doing their Kegels, and I'm doing a pelvic exam. I'm like, nothing is happening down here, but your butt muscles are going. And so it's helping them isolate their pelvic floor muscles. So if you tell me I'm doing a Kegel, I'm going to check and make sure that you're actually contracting those pelvic floor muscles and not holding your breath or contracting your glutes, your butt muscles. Um, and so, yeah, so it's all about the breathing and the Kegels. But my other thing that I do in my clinic is once I teach you how to do a Kegel properly, I'm not going to keep you on the bed and having you doing a bunch of Kegels. What I'm going to do is teach you how to use those Kegels and your ab muscles. So, what we call a pelvic brace. And I get you up and we practice lifting the baby, reaching overhead, all those things that we need our pelvic floor to stabilize. We practice that in the clinic. So I can see how they're doing the breathing and that they're doing their pelvic floor contraction right.
I think that's very helpful. I'm pretty sure I can speak at least for my friends and my relatives all around. We were pretty much doing it wrong if I
Yeah,
am to
yeah.
listen to
Most
you
people, no,
correctly.
most, and that's true because, and so that's my frustration when some patients are sent home by their doctors or their providers, and they say, "Just do 1,000 Kegels or 100 Kegels a day," or whatever. But the patient doesn't, they come in and they're like, "I'm doing Kegels and I'm still leaking," or, "I still feel pressure down there." And then I'll say, "Well, show me." And what they're doing is they're holding their breath and they think they're Kegeling, but they're actually doing a valsalva.
That's incredible information, and I'm sure a lot of our viewers will really learn something new today when it comes to Kegels exercises.
Yeah, yeah. So, and that's the thing, one program doesn't fit all. So I tell people, my patients, when you go on the internet and you're looking at all those programs and stuff, you need to make sure it's something for you. because again, if my pelvic pain patients go on and it's very Kegel focused, it's going to exacerbate their pain, not help it.
It's very superficial information what we
Yeah.
have out
Right.
there.
Right. Yeah. Yeah.